Okay. Good morning, everybody, and thank you for joining us today. We're going to be discussing navigating guilt and a loss of faith in your body after loss. I'm joined with three amazing women today who are going to share their personal experiences and their professional involvement in loss as well. My name is Hazel Leonard. I'm a midwife and a fertility educator. I've been midwife for 16 years, so have supported women from preconception through early pregnancy, birth, in the postnatal period. And, sadly for many women, this is very much part of their story, but I'm privileged that we're part of this amazing community that can help and support and raise awareness on this topic. So let's dive straight in. And if you could all introduce yourselves and tell us all a little bit about your personal experience, your kind of professional background, and why you're here today. Cassie, we'll start with you because you're in my screen. You're the next one along.
Okay. Hello, everyone. Good afternoon. I am Cassie Destino. I am the founder of IVF Support UAE, and I am a fertility doula. I work with Hazel quite often. We help women navigate their journeys through infertility. I myself had a pretty long journey with infertility as I was trying to have my children. After several different kinds of rounds of fertility treatment, I did have twins almost 9 years ago now. I did have a miscarriage after my first IVF. So, for that, I can speak a bit about having to go on to have another child after having that loss and how it affected my relationship with how I felt my body was working. But yeah, I love working with this Love Through Loss community, and it's always such a pleasure and an honor to be involved in these discussions.
Thank you, Cassie. Dr. Talitha.
Yes. Hi, everyone. I am Dr. Talitha Thomas Daniel. I am a primary care physician, but I'm currently working now in women's health education and advocacy. If you look at the Love Through Loss document or post of all the events, you'll see that next week I'm hosting a support time with art for women who've lost their babies. So come along to that if you'd like. And I'm just really grateful to be a part of this space because I have lost my sons about 2.5 years ago. My twins were born at 26 weeks due to TTTS, which is twin-to-twin transfusion syndrome. After a long time of different interventions to try to save them. And they lived in the NICU for our older son, Hosea, for 6 days, and then our younger son, Malachi, for 20 days. And then they both passed away. And then about 6 months later, I got pregnant again. And I now do have a living child called Silive. So definitely there has been guilt in the journey with my sons. And then in pregnancy after loss and parenting after loss also. New levels of grief as I navigate through what I couldn't do for my sons and what I do now for my daughter, and what I can't do for any of them. So yeah, I'm really looking forward to learning from you all and sharing my story as well.
Thank you so much. Helen.
Hi everybody. My name's Helen Walker. I'm a mental health nurse by background. So I've been qualified about 15 years now, mostly within adult mental health. So, working with lots and lots of different people with a variety of mental health problems. But more recently, I've specialised in perinatal mental health. So that's really my love and my passion. I've been in the UAE for about 18 months now, and we're really trying to gain momentum in women's mental health and sort of specifically perinatal mental health. So I'm really pleased to be here, and thank you for inviting me to be part of this conversation.
No, thank you all for being here. And it's quite exciting that there's going to be advancements in women's perinatal health as well, because that's mental health, because that's definitely needed in this region for sure. So I'm going to go to Dr. Talia, Talitha, sorry, if that's okay. Just if you wouldn't mind sharing, when you lost your boys, how did that impact your kind of relationship, loss of faith in your body, and did you kind of carry guilt with that?
Yeah, absolutely. It's definitely been a journey from, I guess, like the minute my son Hosea passed away to even now. I still struggle with a lot of guilt. Some of it was placed on me, just from different people asking questions, that seemed to put the fault on me. Uh, Questions like about the COVID vaccine, like, did they pass away because you were vaccinated during pregnancy? No. TTTS has been around much longer than COVID vaccinations. But so questions like this that were almost immediate, like within the week that my son passed away, people asked me questions like this. So that kind of instilled in me that like there must be something that like I have done wrong or something wrong with my body. And then even more recently, as a friend was navigating through a genetic disease that her son has, I was thinking through like, well, what's the role? What role has my body played in what like my son suffered through? And so then I was thinking through how my body created the placenta that sent too much blood to one son and not enough to the other. Um, and while I know theoretically that that's not my fault, it was still my body. It's not anyone else's body that did this. So that has just, yeah, been so tough. And then with after they were born with breastfeeding, it was incredibly difficult to get any milk out. I didn't have a prior breastfeeding education because they were born at 26 weeks. So we hadn't gone to the classes yet. And unfortunately, medical doctors don't get any breastfeeding education. And so, and then even there in the NICU, I was often told that like your role is only to give milk. You don't need to be here in the NICU with them. And so then when I couldn't provide enough, though I felt like formula is all right, as long as I could just be with my sons. Yeah, I really felt like why isn't my body able to do this basic thing? Which then has carried over into my parenting my daughter, because I had an oversupply of milk, which then just felt like what is up with my body that I couldn't care for these boys and maybe they passed away because I couldn't give them enough milk. And then now for this girl, I have so much milk that I could have provided for all three of them at the same time, which just seems like nonsense. So that's still the
Yeah.
journey one and will
And
probably my whole life.
thank you for sharing that. And I think that's something that we see quite a lot when we're navigating loss is other people's questions, and they, people will ask things in a way that they don't realize sometimes that it's hurtful. But this blame thing, well, somebody must have done something.
Mhm.
This couldn't have happened without you participating in it. So what did you do? Which is, it's just simply, it's not the case. And it kind of shows that level of the lack of education around loss and how multifaceted your specific situation was. It's a twin to twin transfusion and the doctors did everything they could and you did nothing wrong, yet you still carry that on you, like it's your kind of your fault, which, like you say, medically it
Yeah.
isn't, and you have the medical knowledge as well, but those feelings are still there.
Mm.
Cassie, I'm going to kind of come to you, and similar question, but more around the infertility side of it, because and this is something I can speak to as well, is that when your body doesn't do what you expect it to do, it's very difficult to navigate how you're feeling about that. So did it have an impact on you before you got pregnant, and then with that miscarriage, on how you felt about your body and the faith that you had in your body?
You know, I think like so many women, I wasn't ever factoring a infertility journey into my plans. When I, got married and I thought, well, then we'll have a baby. And then it wasn't so simple. And I had to go do all this stuff that nobody else had to do in my circle of friends at the time. At least not that they were talking about. And I had to go have tests done and acupuncture and checking if I was gluten intolerant and like all these things of like, why isn't this thing happening? And I remember that I had my best friend at the time said to me, yeah, I think I'll get pregnant in June so that when the baby is born in this month, and then I can do this thing for work. And it was just, and then she did, the moment she decided to get pregnant, she did. And I was like, wait, other people can just command their bodies to do this thing. And I am like peeing on all of these sticks I've had to order from Amazon, and like I have to keep all this, I have to take my temperature every morning at 5:15, and I'm having to do all this stuff and pay all this money to do this thing that I thought was like literally the one thing a human female body was supposed to do. It's literally supposed to just procreate. And I couldn't do that. And the guilt was more about not being able to give my husband a family. I felt more fear than guilt at that stage. Like, what if I can't do this? So because these hormones are misaligning, I don't get to be a parent. That doesn't seem fair. And I was seeing all these other people becoming parents all around me who were not trying or trying far less, or, not annoyed to find themselves pregnant. And I was doing literally, it was the only thing I would think about in, first thing in the morning and last thing at night. Then, I ended up doing an IVF, and everything, I responded in every way they wanted me to. Every drug achieved its goal. I created these follicles. I was able to collect lots of eggs. They all turned into embryos. They all survived to day 5. Everything suddenly was like clicking into place. So I thought, okay, great. I've cracked it. My body now knows what to do, and this is done. And I did get pregnant, and I was pregnant for 12 weeks until I went and had a scan and there was no heartbeat. And I had to, have a D&C and start all over again. And then that sort of faith that I had built up during those weeks of being pregnant were sort of dashed again. I sort of thought, okay, I figured this out. I just had to do this thing, and now I've done this IVF thing, and now I'm going to do it. And then that didn't work, and I had to start all over again. So I don't think I had full faith in my ability to do this until those babies were in my arms, basically. That was a twin pregnancy. I ended up having several IVFs later. And until, I remember my husband and I used to call when we would have early scans, and we would see heartbeats and we would see them moving, and we would go, all right, the clumps of cells are doing really well today. Let's just keep focusing on these clumps of cells, because that's what they are until they're crying in our arms. They're clumps of cells. Eventually, as my pregnancy progressed and I could feel them moving, and I was reassured that they were okay and very likely coming, but it did. And then, of course, there was some issues with breastfeeding. But by then I sort of thought, all right, body, this is the relationship we're going to have. You're going to do what I need you to do. I'll find you whatever additional resources we need to keep it going. But for me, I think the real test of conviction in what my body could do came at the very beginning, when it just couldn't meet that most basic entry point to parenthood of getting pregnant. And then from there, it's been a negotiation. And as I am in the middle of perimenopause, the negotiation continues.
Yeah, I mean, I can definitely, that's something that's kind of very similar, and it's what we hear quite a lot, isn't it, of this you get this blame thing, and you get from trying to conceive to any losses of like, oh, you know, whose fault it is and where's the blame, and you kind of take, I think as women we have a tendency to take those things on our shoulders as well. You know, it's all about us and what we've done or haven't done, and then you kind of you put that barrier in your body, so then when you have a pregnancy after loss you tend to go, well, this body, I don't trust you, so what are you going to do to sort of mess this one up, which then impacts your experience. You know, it has a big impact on future experiences. So Helen, I'd like to come to you. For anybody experiencing these feelings of guilt and self-blame, are there some kind of practical steps that they can take to kind of begin to heal emotionally?
Yes, there are. But firstly, I don't want to undermine the sort of the pain and the suffering that people are experiencing. Obviously, at the time, it's very real and it's very raw and it's deeply, profoundly painful. And I think that just hearing the two stories today from Cassie and Talitha, it's people's experiences are so different, you know. So I think everyone's going to need different things at different times. It's such a unique and personal journey. But I think really the overarching message and what would be appropriate for everybody at any time is to practice self-compassion. And I think it's important to give yourself permission to feel whatever you're feeling. It's okay. You know, whatever feelings may be, allow them to be there. But I think, you know, allowing sort of time and space to grieve and to adapt, really. It's a time of huge adapting to a new normal, a new reality, and your sort of whole perspective of the world around you changes. And it's just having that sort of giving yourself permission that will take time. It will take time. But in terms of a practical tip, so sort of practical tips that I could give in terms of practicing self-compassion, and it's really cliche, but it's taking each day at a time. And what we mean by this is sort of doing whatever you can to ground yourself in the present and in the moment. And there's lots of things that we can do to do this. And, you know, we may have heard them being called grounding techniques or mindfulness. So something really simple like breathing. So breathing techniques can be really effective. So box breathing, for example, where we can choose something in our surroundings that's square. We can either imagine a square or choose something square or rectangular in our surroundings. So I could use my computer monitor now. So we would breathe in as we go up the side, hold as we go across, breathe out as we go down, and hold as we go across. So we'd inhale, hold, exhale, hold. And the aim is really to slow this process down, to slow our physiology down gradually as we're doing it. And this is, you know, we know that this brings us into our present moment. By focusing on the breath in the here and now, we are taking our focus off our spiraling thoughts. So, and as well as that, we are physiologically activating our parasympathetic nervous system. So by breathing and slowing our breath, especially that exhale, we are activating that parasympathetic nervous system, which gives us that feeling of calm and relaxation. So it's just doing that sort of here and now things really can be really helpful.
I mean, it definitely can. You know, there's many people that I've supported that are quite skeptical of, you know, mindfulness or breathing or meditation or yoga or, you know, let's say grounding techniques. But then once they start using them, they can be very helpful. And even, I mean, we were talking yesterday, Dr. Talitha, weren't we? And you were saying that you had a moment where you smelt some hand sanitizer. I hope you don't mind me sharing. And that was quite triggering for you. And very often for people navigating loss, what they'll say is that, you know, like today, you're coming into today and you know you're going to talk about this topic and you know you can prepare yourself, but sometimes it's the things that catch you off guard. So if you've got these tools and these techniques, it can really help you in those kind of moments. So thank you for that. I'd like to go back to Dr. Salitha and Cassie, and just, you both touched on it a little bit already, but just kind of after loss, when you went into your pregnancies, how did that impact how you felt about the pregnancy, you know, having, and how your body was working, and did you have completely lost faith in your body at that point, or were you working through it? Like, how did that impact your loss, impact your next steps, your next pregnancy?
Yeah, I definitely think that throughout the journey, my thought was just like, what's gonna go wrong this time? There were I'm really grateful. I can't remember all the things I felt guilty about. But there were so many things that I felt with my pregnancy with my boys that I was like, was it this thing that I did or that thing, or like which thing was it that made it so that the interventions wouldn't work or whatnot. Even though again, like medically, I know this isn't like rational thinking. And so then with my daughter again, like every appointment I was wondering like, when are they going to tell us that like something is wrong? It was really hard for me to connect with her, even though she was inside of my body. Yeah, which I mean, I'm really grateful that I received some good input about like how to build a connection with her through reading books to her or whatnot. But it definitely was really difficult to believe that she was actually going to come out at the right time and stay with us. I still kind of struggle with that. Very often I wonder like if today is the day that she's going to pass away. Which is horrible. Who wants to feel that way about their child or anybody really? But yeah, especially when she was inside of me, I had a lot of questions about what my body was going to do to cause her to pass away. Yeah. And then of course
That's incredibly difficult. Yeah, it's incredibly difficult, isn't it? And these intrusive thoughts that people often get. And you know, and I've had them as well with my little one, especially, you know, this is a really supportive event, but she was like 4 months old this time last year, and I'm like, oh my God, what's going to happen? You know, something's going to happen. Something's bound to happen, because we work so hard to get here that it can't be all smooth sailing, and you have these intrusive thoughts, and especially postnatally and with all the hormones and everything that's going on. You know, we're programmed to keep these little people safe, and that loss of control, and it can feel so overwhelming. But also lots of women don't feel they can share those thoughts, because people will think that they're unstable or they shouldn't be having them, when in actual fact they are very, very common, very, very normal.
Yeah, I'm thinking about, especially in the early months, maybe even a year postpartum, just like everything I would do something wrong, then I would think like, oh, like I didn't deserve my sons. That's why they're not here, because I'm like such a crappy mom. Like I let her fall off the bed or whatever small thing it was. Which maybe wouldn't have impacted me as much if my sons hadn't passed away. But in this journey of parenting after loss, it just felt like every small thing that I did, yeah, brought it again that like it's my fault that they're not here, like, or I don't deserve them. Or like I shouldn't be their mom. Like I'm not good enough to be their mom.
Which we know is definitely not. We know that's not the case. You know you're a fantastic mom, but yeah, the guilt of putting that on yourself is huge. And how about you, Cassie?
My experience with it is a little different. I think that when I lost the first pregnancy, I was far enough along that they had to do a D&C, and they were able to send that material to the lab and give me some kind of an answer that there had been a genetic abnormality, a chromosomal abnormality, and I could see what it was. And I was, you know, said, look, if you had done genetic testing before this would have been caught and we wouldn't have transferred this embryo. So when I did my next IVFs, it was actually a few IVFs later that I got pregnant with my twins. I had done that testing. And so when I was pregnant with them, I was able to sort of lean into the science a little bit and say, well, the thing that happened last time is unlikely to happen this time because I didn't do this step that I've done this time. And, you know, this sounds a little woo-woo, but the whole time that I was pregnant with that first pregnancy that ended in miscarriage, I just always sort of had this feeling, I don't see a baby at the end of this. I know I'm pregnant. I see the heartbeat on the scan. I, you know, feel funny and different, but I don't picture this. I can't see this. And when I had to go in for that D&C, this was in San Francisco before I moved here. I said to the nurse, you know, I had this feeling, and she said, "Do you know what? I hear that every day with the D&C patients, that they kind of know somehow, you know." And then when I got the positive pregnancy test that ended up being, you know, my twins, I just had this feeling of like, oh, this time it's gonna go. And I can't put my finger on it. I don't know what that's based on. It was just this sort of intuition of, okay, you can chill out. I mean, not that I did chill out. I still, you know, I still had the clump of cells thing going for a while. And, you know, every time I went to the doctor for a scan, I always made them take my blood pressure at the end of the appointment. I was like, look, there's no point in taking my blood pressure now because it's through the roof until I have that scan and I see that heartbeat. Let's not waste your time. So, and I did have, you know, I bought a crib when I was like 25 weeks pregnant. I bought a crib and I almost had a panic attack that I was somehow tempting fate, but I don't really actually believe that. Yet somehow it still got in. And my husband doesn't believe it at all and had no, like if I said, oh, I think I've jinxed something, he would make me sleep in the car. Like he does not believe in any of that. And he kind of helped me be like, well, science says this and statistics say that and evidence says this. And I was able to sort of focus on that. So for me, it wasn't so much like what's going to go wrong this time. I sort of had the opposite thing where I was like, I deserve it now. I paid this price before. I've done the thing I was supposed to do. I've taken the tests. I've paid for the testing. I've taken the folic acid. Like this is a go. And you know, it was, and they were born full term. And you know, no, that's not to say there weren't issues with breastfeeding and you know all kind of hernias on my daughter and things like that. But all of that felt like, well, that's just having a baby. Like everyone, that isn't a special Cassie experience of having a baby. That's just what it's like. So I was able to kind of, I had done also a lot of CBT several years ago, cognitive behavioral therapy for anxiety. And I was able to use those tools and be like, all right, let's talk through this. What's the more likely thing to have happened? What is this coming from? Where can I kind of turn this down and focus on this? So I think that actually helped me a great deal as well.
The tools for mental health, definitely. So that kind of brings me nicely to Helen. When people have lost trust in their bodies, Helen, what if they're like, you know, especially a disconnection, or they feel betrayed, or they just don't trust the thing that's happening to them? Are there things that they can do to rebuild and regain that trust again?
Yeah, that was so interesting listening to you, Cassie, because as you were talking, I was thinking, she's doing a CBT. She's doing CBT on herself. And so obviously you've used those tools and that knowledge of previous therapy, and you've brought it into challenging those thoughts and challenging that anxiety in, you know, later down the line and in this situation. So I think, yeah, having the education, I think, can be really helpful. And again, there's still the same principles apply. There's no one sort of size fits all for everybody. But for some people, having the education around what happened medically can be really reassuring and relieve some of that feeling of guilt. So, you know, most maternity providers do provide like a debriefing service, so you can go and get all the facts just to gain that closure, really. And that for some people may be enough to move, you know, allow themselves that, to relieve that guilt and pressure on themselves and their own bodies. Even so, even if sometimes there's not an answer and there's not a medical reason why, which is often the case, isn't it? It's still just talking through with a medical practitioner, and that having that reassurance in a trusting and safe space can be enough to relieve some of that guilt and pressure. But then I guess it's knowing and noticing when it isn't enough, or if it goes beyond that. So, and we see it especially commonly in subsequent pregnancies as well. So it's knowing what is a normal anxiety, and any pregnant woman will have an element of anxiety that will be heightened if someone's experienced a previous loss. And then it's okay. So can you challenge those thoughts, as Cassie did? Are you able to kind of rationalize and move past those thoughts to be able to function and live your daily life? Are you able to dismiss those thoughts, or is it more intrusive? Is there something more going on that needs potentially mental health support and more interventions professionally? There's so much treatment, there's so much that we can do. I just wanted to sort of say that just you know, experiencing loss in itself doesn't mean that you are mentally ill at all. But what we do know is that having these traumatic events and these, you know, awful things happen can make us more vulnerable to experiencing mental health problems, either in the immediate or in the future pregnancy. So really, I would reassure and really advise people really to go and seek medical support, reach out for support if you need it, through psychology or through a mental health nurse like myself. It's really helpful in the moment, in containing and offering that safe space to feel and to allow the present moment, but also it can prevent potentially things from developing into a more serious mental health problem like anxiety or depression, or it can we can detect these things earlier to prevent things from getting worse.
Yeah, that's really great advice, is to seek that support. And I mean, I would recommend for anybody that's suffered sort of any kind of loss, that a therapy, you know, having the mental health support is extremely important, because there's not many people that can have a loss like that and just go through it alone. You know, there's communities out there, there's support out there. Access it. You know, if it could be that you have to pay to go and see a counsellor or a therapist, but if you don't have the financial means, then there are support groups like, you know, Love Through Loss. You know, this is what we're all here for, to make sure that people aren't navigating those things alone. And that just comes me to kind of ask all of you, if you could, you know, what advice would you give from, you know, for you, Helen, as a professional, and both of you guys for your personal experiences? What advice would you give to somebody, maybe they're navigating a loss, or they're worried about a future pregnancy, or they're just unsure of how to trust their bodies again? What kind of advice would you give? We'll start with you, Helen. You're in my screen still.
Okay. I think obviously all the things I've already spoken about. So be kind to yourself. Take each day at a time and focus on the moment. I think human connection is really important. So whatever that looks like for you, it may be a loved one, it may be a close friend or relative, it may not be. It may be reaching out to peer support, connecting with other people who have had similar experiences. It may be reaching out to a mental health professional. And I think one thing from me, it's World Mental Health Awareness Day today, 10th of October. And I wish and hope that emotional pain can be treated and seen and acknowledged just the same as physical pain. So I think if we injured ourselves in a sporting accident or something, we hurt our leg, if that pain persisted, we wouldn't hesitate to go and get it checked out. And I think that should be the message really with our mental health. If things are becoming too heavy, or you are not able to function in your day-to-day life, if you're feeling hopeless, if intrusive thoughts and anxiety are overwhelming, if you're not able to dismiss them, then please reach out for support. There's so much that we can do to help and move through this together.
Thank you. Dr. Talitha.
Yeah.
Oh.
Yes. I'm sorry. I also, as I was thinking through this question, I was just thinking how important it is to not be alone. How important it is to surround ourselves with those who speak life and truth to us. As we've all touched on, I think it's so hard to deal with your own thoughts on your own. Even if, like me, you have a wealth of medical knowledge behind you, it's still really hard when you're in the moment and when you're experiencing these things. And so however you can find people who will tenderly speak the truth to you, I think that will make a huge difference. Which is why I'm so grateful for this like Love Through Loss community and the resources. So even if you don't have a huge friend group or family or whoever, sometimes family or friends are not even supportive. But I think that like we people can be confident that if they reach out to us, we will be there for them to support them however we can.
Finding the right people, isn't it? Finding the right people to support you. And like you say, sometimes that is family and friends, and sometimes they don't know what to say, so they say very much the wrong thing. So it's looking at people within this kind of community. But you know, some people equally have an amazing family support and friend support network. So it's finding the right people to support you, but ultimately not doing that alone. How about you, Kathy?
I
Any
would
final
say,
words?
I would say that there is no one path through grief or anxiety, or, you know, what works for one person is not the solution for another person. And to just, the advice that I would give to someone is that there are so many different tools out there, and everything you're experiencing, someone has thought about and experienced before and has there's something to help you with it. And it's that you might have to navigate it a little bit, but just know that there is help. It might not be the first piece of help that's put in your lap, but that's okay. You can put that piece of help aside and seek out another. And that, you know, for some women, it's going to be therapy. For some women, it's going to be and when I say therapy, there's like 100 different paths to go down when it comes to that as well. But that if you focus on it, you can find the path that works for you. Maybe it's a short term of some medication to help you get going and to help you start to deal with stuff. And maybe it's, you know, a longer course of talk therapy, or something shorter like CBT that's like learning a set of skills that you can start to implement. Maybe it's endlessly Googling things. It's probably not, but there's always going to be something that will help you. And your best friend might not know what it is, your sister might not know what it is, your mother might not know what it is, but you'll kind of find it if you look for it kind of deliberately and intentionally. And you just sort of take on what makes sense to you and put aside what doesn't make sense to you. And you know, eventually you can kind of put one foot in front of the other until you start to feel better.
Amazing. Well, thank you all so much for your time today and for sharing all of these really valid and important points with us. So yeah, thank you, and I hope you all have a lovely day.
Bye, everyone.
Thank you,
Thank
Hazel.
you.